The Trump administration is clearing the way for Maine and other states to require some Medicaid recipients to hold down a job in exchange for health care coverage. These new guidelines were issued by federal health officials on Thursday. Maine wants to make changes to its Medicaid system, known here as Maine Care, and those changes include requiring recipients to work at least 20 hours a week and pay monthly premiums for their health care coverage. Advocates say these new guidelines are unfair and that they're not going to hold up in court. NewsCenter's Vivian Lee has more.
Eugene Jordan's son can't find work after losing his job as a roofer. He says the new guidelines requiring Maine Care recipients to work in exchange for health care coverage will leave him out in the cold.
What do you do when somebody lives 12 miles out of town and they've lost their job because the state took their license and they can't go to work, can't afford gas or insurance, but they got to work to get help?
The rules issued by the Trump administration will allow states to end Medicaid benefits under certain guidelines. In Maine, DHHS officials want Maine Care recipients to work 20 hours a week, either be in school, are a caregiver, or participate in an approved form of community engagement. Maine Senator Susan Collins, who visited with seniors in Lewiston Friday morning, says it's not unreasonable to require able-bodied adults to work, but she is concerned about other recipients not being able to get coverage.
There are people who have caregiving responsibilities or who are struggling with addiction or have a disability who would find it impossible to work. And I want to make sure that we proceed very carefully.
I think it's a very good idea to help people learn how to work and learn a skill, do some volunteer work or further your education in return for that public assistance.
There are exceptions: the disabled, elderly, and pregnant mothers and children. Steve Butterfield, the policy director with Consumers for Affordable Health Care, says the majority of Medicaid recipients studies have found are already working. Now, Maine DHHS officials also want recipients to pay a monthly premium and chip in a minimal fee for non-emergency hospital visits. In a statement, the department said the waiver is important to continue their efforts to break the cycle of poverty in Maine, but it's not known when the new rules will go into effect. In Augusta, Vivian Lee, News Center, Maine.
Maine is just one of nearly a dozen states that applied for a waiver to allow this work requirement for Medicaid to take effect. Just today, the Trump administration approved Kentucky's request to add that requirement. We're still waiting to hear about Maine's.